cancer was a death sentence to something like cancer to a chronic disease?
Many people are not scared of death. They're scared of the suffering. I don't want to try all this chemotherapy and everything. I want to try coffee enemas. And remember, half-truths are actually more dangerous than myths. In real life, all fights are slow, they're gradual, and victories come battle by battle.
So welcome to the program, Doctor. It's a pleasure to have you.
Oh, my pleasure. Thank you very much.
So tell me honestly, cancer is one word which can stop the conversation instantly. But today, cancer is no more a death sentence. So how would you like to look at this word?
Oh, absolutely. I mean, you said it. So cancer is a dread word because for ages, the minute people hear cancer, you get all these images of suffering, the hair drops off, the teeth fall off, you wither away, and you die a horrible, painful death, and there is no cure for it. This is the age-old impression that is being conveyed by the media, by the movies. All kinds of heroes, both in Hollywood, Bollywood, and Tollywood, have been dying of cancer at one point in time. But if you notice, they're not making such movies anymore.
Yeah.
So, and if you notice, Raj Kapoor and all in their generation died of TB.
Yeah.
And nobody talks of TB now. Same way they've stopped making movies about heroes dying from cancer now. So that should tell you that cancer has now become conquerable. I think the total count is something like 800 kinds of cancers and counting. More than 60% are completely curable. And by curable, I mean that they can go away and never come back again.
That's really gives some hope, I'm sure, to most of our viewers who are watching this. So can we say that we are moving from an era where cancer was a death sentence to something like cancer to a chronic disease?
Yeah, absolutely. So if we 60% we are saying are curable, cure means it goes away and never come back again. So forget about a death sentence. You're getting a normal life back. Now, in the other 40%, the majority have been converted into a chronic disease, like diabetes, for example. So you can't cure it, you can't get rid of it, but you do make people live better and live longer. And as far as I'm concerned, the majority of my patients have noticed many people are not scared of death. They're scared of the suffering.
I'm sure that's a different perspective altogether what it was. What are some common things that people Google wrongly and then come to you and then you have to explain it all over there?
So Google is a boom and a bane.
Yeah.
Now artificial intelligence has just made it worse, probably not better. As I keep telling patients, garbage in, garbage out. If you do not know what to ask, you're never going to get the right answer. So there are two tricks that I think all of us need to learn. What is the right question to ask? And who do you ask? These two matter a lot. Answers are easy these days. The question is the important thing. So I think one of the funniest person that I had who is a highly educated patient, who is in the media herself and very well read and very well qualified, who came to me and said, I don't want to try all this chemotherapy and everything. I want to try coffee enemas.
Really? Yeah. Coffee enemas?
Absolutely, coffee enemas. I said, I've researched this and I found that coffee enemas actually work. So that's what I want. Would you please give me a coffee enema?
What was your reaction instantly?
My reaction, it'll probably give you a high and I don't mind giving it to you. Except that don't expect it to cure your cancer.
This is really scary. I don't know where that information is all coming from.
Absolutely.
Yeah. So you've mentioned, there's so many cancers around the world. I think you've said a large number. So is that really the fact or are we diagnosing it smartly today?
I think both. So cancer ultimately is a lifestyle disease, and I'm sure you're going to ask me about that at a later point in time. Lifestyles are changing. We are becoming more and more industrialized, especially in the third world. We're emerging from the quote unquote the third world into the developing world. So as industrialization increases, as our lifestyles change, cancers also do increase in real time. So that's very real. The increase in cancer is very real. Apart from that, diagnosis also has become more sophisticated. So we are detecting cancers earlier than we were before. People have become more sophisticated. They go to their doctors before as compared to previous generations. So they get detected more often. Also, cancer outreach programs into even smaller cities and smaller towns has increased, so that we are now able to diagnose cancer more even in the remoter areas. So yes, part of the increase that you see is because of increased diagnosis, but a lot of the increase is also very real.
So apart from coffee enemas, which will not cure cancer in any which ways, what are the other common myths that you generally come across, Doctor?
One of the commonest myths I've heard is, I stopped eating sugar because sugar feeds cancer. That's a half-truth. And remember, half-truths are actually more dangerous than myths. Myths you can disprove. Half-truths are more difficult to disprove. All living cells need sugar to survive. That's what they use as their fuel. So cancer cells, but your cells, normal cells also need sugar to survive. So if you stop doing sugar completely, what happens is you are starving your own normal healthy cells more than you're starving the cancer. So that's not going to work. So diet plays an extremely important role in dealing with cancer, both in preventing cancer as well as in healing cancer, as well as in curing cancer. But there's a way to do it. So I would suggest that, as I said before, look up a valid site. There are some excellent dietetic sites which actually give you very valid evidence on what to eat, what not to eat, how to modify your diet. Your doctor can help you with that, or any qualified dietitian can help you with that.
And we've heard every doctor would be talking about diet and exercise and smoking and alcohol. But if there's one habit, if we all could follow, and that would really make a big difference starting today, what is that one habit you would preach?
Fruit and fiber. So if you're talking about prevention of cancer in an otherwise healthy individual, start early, start young, start well. Fruit and fiber are your best friends as far as the cancer is concerned. The standard American Dietetic Association recommendation to eat 5 cups of fruit a day. I myself am an aspirant. I cannot do this, but I aspire, and I think everybody should. There's also a lot of mythology about fancy fruit. I eat passion fruit, I eat dragon fruit, I eat this particular fruit.
Exotic fruits.
Exotic fruits. You don't have to. If you like exotic fruits, you can afford them and you go for them. That's well and good. That's not a problem at all. But you do not have to. Ideally, you should be eating what is locally sourced and locally grown for a very simple reason. You and I, if we live in Hyderabad, this is a particular climate and this is a particular weather, and we as human beings have actually adapted to this weather and this climate. So have the fruit that are grown around Hyderabad.
Basic, and that makes total sense.
So if any of the old Hyderabadis recall, actual native fruit grown around Hyderabad are jamakaya, goas, grapes, stuff like that. So sitafals.
Another common myth we generally hear is, there's no family history of cancer in my genes, so I don't think I would be getting that.
The majority of cancers are not carried in families. They're very individual. So as I keep telling my patients, you got to understand this is a machine. It's got moving parts. Okay, and it's got actual matter. And from the day you're conceived, we're not even talking about the day you're born. We're talking about the day you're conceived to the day you die. This machine has to work 24/7. Now tell me any machine with moving parts that has to work like that and not have any mistakes happen. They will, inevitably. These mistakes quite often accumulate over time. So if you give it a chance with a healthy lifestyle and a good diet and good exercise and other things, the body is perfectly capable of repairing its own mistakes.
So how do you think is the best way to pick up this mistake early?
Oh, there are several ways. One thing, as we said, is lifestyle. So more fruit, more roughage, that's fibers, a well-balanced diet with enough starch, enough protein, enough vitamins, and antioxidants. Exercise, especially aerobic exercise, that has been proven to decrease certain kinds of cancers, the risk. Hopefully a pollutant-free life, which is a near impossibility in modern life. But again, that's an aspiration that we can look forward to. And certain basic care that we take in our employment and so on and so forth. Most important of all is avoiding known cancer-causing substances. And the world's number one cancer-causing substance is, you know it.
Yeah, I think we all know it.
Tobacco, yeah.
So looking back at the cancer treatment, doctor, a lot has changed, So what are some big breakthroughs that you have seen in cancer therapy, be it even 5 years ago?
Until the 1990s, these were the three mainstays of cancer: surgery, radiation, chemotherapy. Things really started to change in the 1990s. So decade on decade, we have had marvelous advances. The 90s was a decade when we came up with targeted therapies. Changed the scenario for cancer. Then the 2000s is when we came up for newer chemotherapies and newer surgical techniques, newer radiation techniques for cancer. Changed the scenario for cancer. The most recent development that you're talking about, that you're asking about, the really modern development that has changed the way almost how we treat cancers are immunotherapies. So these are the therapies that are really the soup du jour, as it were, in the last 5-6 years. And they've changed the landscape of how we treat cancer. So immunotherapies are an entirely new class of cancer, not one single medicine, it's different kinds of medicine. So acting in very different kinds of ways. But what's common between all the immunotherapies is they do not kill cancer cells directly. They stimulate your own immune system so that your immune system kills the cancer cells, sort of the same way that vaccines work. So that's been the modern advance that has become very, very widespread in a lot of cancers now.
So do you see a future where we live in cancer-free world?
Absolutely. Already we're in the process of exterminating cancer, and I'd like to take this opportunity to mention that cervical cancer is one such cancer which we can hopefully exterminate completely as we sit and speak today. We have a vaccine for HPV now. Most people know this because it's been in the news for a while. I would strongly encourage everybody who's eligible to take this vaccine. In real life, all fights are slow, they're gradual, and victories come battle by battle.
So having watched cancer so closely and studied cancer in and out, what are some habits that you have made consciously?
That I have made consciously? Well, I'm trying to lose my weight. I've been quite successful, but I'm human. I lost quite a bit, became very trim and muscular, then I put back weight on again. So this happens to everybody. So that's my personal journey. Bad eating habits, irregular timings. So eating on time, eating healthy, eating well-cooked home food, I think is really, really the number one thing that all of us should be doing. Second thing is exercise. So I'd like to remind everybody, intensity does not matter. So keep your goals realistic. Do little bits consistently. So the intensity doesn't matter, consistency matters, regularity matters.
So you always wanted to be a doctor, or you had some other plans?
No, I didn't want to be a doctor. Actually, I was a clueless teenager, like any other clueless teenager who didn't really know what to do with my life. And my mother said to me, "Why don't you become a doctor?" And I said, "I'm not particularly interested in being a doctor. Why are you asking me to be a doctor?" She said, "Apart from the fact that there are other doctors in the family, and you can all gang up together." She said, "This is the one profession where you can kill people and get both awards and money for it." Okay, so if you go join the army and kill people, you'll get awards but no money. If you join the mafia and kill people, you will get money but no awards. So medicine is the only one. She said it in a lighter vein, but that's not a bad concept by law. So I guess that's how the journey started.
So given a choice, would you still stick to medicine or something else?
Absolutely. There was a point in time. So medical school was tough. Medical school, because there's an overload of information, obviously. And then you got to try and wade through with it and all that. And we all managed. I managed just like any other student does. But at some point in time, I did fall in love with medicine. It's more or less like detective work.
Though it was not love at first sight.
No, it was not love at first sight, but it was very much love at second sight. It's basically a detective job. So you track down a disease and you're like Sherlock Holmes trying to follow the clues and all that. So there's an excitement in that. And there was some point I fell in love with it. And then when I was in my post-graduation doing my residency in internal medicine in the US, I did a rotation through oncology. And that's when I actually fell in love with oncology. So cancer is my thing. So that's why I became a cancer and a blood specialist.
And finally, doctor, if there is one thing to take away from this conversation today, what is that one thing?
Optimism. Let's end on the note that we began. Cancer is not a word to be feared. Cancer can be prevented. Cancer can be cured. Cancer can be treated. Be optimistic about the world, whether it happens to you, God forbid, or whether it's happened to anybody in your family or your friends. Optimism is the key. There is too much pessimism of too many things these days. Be optimistic. Things will go well.
So we might eliminate cancer in the future, but let's eliminate the fear and the anxiety what is associated with cancer today.
Absolutely.
So thank you, doctor. It was wonderful having a conversation with you.
Thank you very much. My pleasure to be here.